here, as I said, प्लम्बिंग डिफेक्ट है तो तुम होलिस्टिक का क्या करोगे? वो तो पार्ट को तो तुमको वर्कआउट करना है ना.
Correct.
If there is a problem conceiving because of a fibroid,
Yeah.
you have to get it
Removal,
removed.
yeah, is must.
So that's what I've been saying, that homeopathy for chronicity, for balancing of the hormones, to develop a fertile background so that even your treatments work. There's so many failed IVF cycles.
Yeah.
Why? Because there is no balancing of the hormones. You're doing it everything by stimulating the ovary, creating a good bed for the embryo to get. How much will you pump the body?
Hello and welcome to Imperia Connects, the podcast focused on family well-being. Today's episode is dedicated to health and gynecological challenges many women face, from puberty to menopause, infertility to fertility, and everything in between. We are here to shed lights on these issues, share expert advice, and empower women with knowledge. So let's understand what matters the most and understand your body better. Let's welcome our expert for today, Dr. Kukreja A. Kalani. Hello, doctor. Welcome to Imperia Connects.
Thank you, Madhvi, for such a warm welcome.
I would like to know, in your practice, when you started the practice in a couple of years back, what was the common question or common concern women had during that time? And what is the common concern now when you are consulting a lot many younger women?
Yes. So earlier it was more to do with the pathological stuff like fibroids, or something to do with severe menorrhagia or metrorrhagia, that is the menstrual irregularities. But nowadays we are getting more and more young girls, say they've just done their class 10th grade or maybe little more earlier, and they are coming up with symptoms of irregular periods, and that's the way we get a sonography done, and we find that they are having PCOD.
Okay.
So, because of the awareness, the parents also are concerned and they like to screen and find out what it is. It's not a bad idea, but we are seeing more and more cases of PCOS, also to do with painful periods, dysmenorrhea, and pathological condition which is called as endometriosis, where earlier there were very less number of cases, but now we find these cases coming up more and more. So now that's directly linked to the hormonal changes which are setting up too early in women, say because of the lifestyle changes or because of simply stress. So these are the things which we see commonly. To start with PCOD or a PCOS, it's the same thing. So it's a group of symptoms or syndrome. It's a clinical manifestation. It is not called as a disease per se.
Okay.
Because during each cycle, the follicles mature. So the ovaries, the number of eggs on the either side, the follicles start maturing, and only one dominant follicle, say, forms a proper egg, and then it gets to for the cycle of ovulation, that is on the 14th day. But this whole synchronous process has been disrupted. So there are more and more follicles which are maturing, but none of them are getting into a proper ovulation, and none of the ovum, the quality of eggs, is also reducing. So over a period of time, not as they age, they get married, we are facing problems of infertility also.
Okay.
So the cases of infertility are also on a rise because women don't want to conceive for all the obvious right reasons, say career, so they delay, and when they decide to conceive, then their biological clock and even the quality of ova has regressed, or the quality is not all that good. So we don't have a very happy, easy experience with the pregnancy, the full 9 month, So the difficulties carrying the baby or producing a healthy child is fine, but then we have problems, say, with the cervical incompetence, so we have to put them to bed rest. So all these things are increasing. So it's not a very easy pregnancy, and so this is what that changes in the presentation of complaints when it comes to young girls or during their childbearing years. So there's a chain.
Now, coming to regular periods, what is technically, I mean, medically, what is a normal period and what is irregular period?
Yeah, so it's basically what is in the books, or is a 28-day cycle, but it's never like that. A woman can have a 22 to 35-day cycle that is considered to be normal, depending upon each one's, individual genetic presentation. So the 22-day cycle also is considered to be normal. A 35-day cycle is also okay. But
Okay.
when the cycle shifts, a 35-day cycle shifts to 22-day cycle, then then we worry.
So
If it
say
happens
in 12
once,
months, in 12 months you have 1 or 2 months where the days are 2 days
it's
here
okay.
and there.
Yes,
That's
that's
normal.
fine. That's
Okay.
fine. So when you have repeated shifts of more number of days, then it we worry. But that's also okay unless until we don't find something, major grave changes. All right. So that is the normal menstrual cycle. So first it starts with the shedding of the endometrium. Then it is the 14th day of ovulation. Hmm. So and then the progesterone buildup happens if the egg is ready and the right point, say the sperm also, and the embryo formation happens. It is good. Otherwise the levels drop, the progesterone drops, the estrogen drops, and the endometrium, which was building up to receive the embryo, begins to break, and then over a period of time, the shedding starts back. That is the menstrual cycle. So we call it that the uterus is crying over the lost ovum. That is how it is written in the books when you don't conceive. So it's
Oh.
each while, during each cycle, the number of ovas which have matured, and out of that only one ova, which was a lucky one, get to it, was there, and that also didn't get fertilized. That it's a very statement which used to, how have they written this in the book? But
Yeah.
it is there that the uterus is weeping over the lost ovum.
Oh, weeping. That's a
That's the shedding of the endometrium.
yeah.
They're talking about the menstrual
Yeah.
cycle. Yeah.
And what happens later if your uterus is weeping and then
That's a normal cycle.
tearing?
That's just to make the topic interesting,
Okay.
so that we understand the synchronous rise and fall of hormones. So it gets to a mind. Okay, this is how it is.
Okay. What your health is when you are young and when you reach towards menopause, these symptoms keep on changing. So every
Yes.
month you might have the same symptom or you might not have the same
Yes.
symptoms, but usually they come up with some emotional challenges or they come with painful
Periods.
periods. So
Yes.
what causes them?
Yeah, see, some amount of pain is normal. So that's called as primary dysmenorrhea. The problem starts when the pain increases during menses, before menses, or the pain continues even after the menses have been done. Then it's the point that we have to investigate why the pain. What is the problem? Is there any adhesion? Is there any ovarian cyst? Or is there endometriosis which is developing? Now, what is endometriosis? So, endometriosis is the uterine lining which develops, that is the endometrium, and the similar tissues are found outside the cavity, which is not normal. So it will
Okay.
be found over the ovaries, or it would be found over the fallopian tubes, and they are under the direct influence of the changing hormones. So as the endometrium builds up because of the normal change of the hormones, similarly the other areas are also developing. Here we have a proper way the menses flow out of the cervix, vagina, and out. But over there is nothing, there is no pathway to out. So there is swelling. There is tissues which are, swollen up. There is inflammation, and that causes, say, adhesions, or it's an abnormal thing which is there, and that causes pain. So you may have pain while passing urine, you may have pain while passing motions. During periods are very painful, so it is a pathological condition. So it is one of the causes of infertility also. So imagine the fallopian tubes are sticking, the pathway is blocked. So how does the travel happen? The ovum, which is traveling from the ovary to the fundus of the uterus, and then it gets embedded and wanting to meet the sperm. So that whole pathway is blocked. That's because of the adhesion. This is just one reason. It also could be tuberculosis. We have to take a history to understand what is the reason of adhesions.
And also very difficult to understand what is
Yes,
happening inside. Like say your tubes
yes,
are like there is a blockage or
correct.
something. Very difficult to understand from
Understand.
outer side.
Correct.
Like
So,
at what when do you recommend that the testing should
yes,
happen?
so we have various techniques and investigation methods like, HSG. So we introduce a contrast dye to the, to the cervix and the, so the vagina, cervix, and it enters and we see the patency of the tubes, or we find any blockages or the areas where you find that there's a blockage, there's something not normal. So these are the ways of understanding what are the areas which are affected. Similarly, we have a hysteroscope. So you're actually like a camera you put inside and check what is the, what's happening inside, whether there's a fibroid or there's a thickened endometrium, or there are a lot of tissues which are there which are developing without reason, and we have to figure out what it is. So we take out a little bit of a sample and send for HP, that is
Okay.
histopathological investigation on doubt. So there are a lot of things, and very in a methodical way we can find out if there's a mechanical blockage which is not allowing the pregnancy to occur. Apart from that, clinically also, we can take a full case history to understand the metabolic syndrome, that we have diabetes, blood pressure, or if you've had a family history of some major grave illness, say cancer. So we take a detailed case history to understand the constitution, where it could go, what could be the probable reasons for infertility. And once we figure out, we try and fix that.
All these examinations, they happen when you are planning to conceive or you are planning
Yes.
for
Yes. Now, if you,
motherhood.
not really. They could be painful, as I said. Some disturbance here and there, not a problem. Some pain, some irregular. It's only on the screening
Okay.
you'll come to know that there is some pathology which is picking up.
So having fibroids also, like if you just say you have fibroids, but then you have not planned to conceive. Till then,
Yes.
they don't
Yeah,
create any
now
issue.
fibroids are basically because of the estrogen dominance. So during the childbearing years, when the estrogen is good, and some abnormality happens in some other axis, or the hypothalamic pituitary ovarian axis is what is responsible for all the cycle and everything in the woman's life space. So if there's problem with the hormonal change, or there are growths which are found in the uterus, then it could actually occupy the space where the baby is going to develop. So, where will the baby come up? Because the fibroid has already occupied. There is no other way, we have to remove it. Yeah? So, what are the causative factors for fibroid? We don't know exactly why does it happen. It can be found at the fundal, it can be found at the posterior, part of the uterus, anterior fibroid. So there's a study, if it is found on the posterior part, it may be linked to infertility. Plus, at what layer does it develop? It's a subserous, submucosal fibroid. It's intramural. So it's a lot of deep study to understand where it is growth and where. Sometimes a small fibroid bleeds heavily, and sometimes such a big fibroid doesn't bleed. It goes unnoticed unless until you take out a sonography
Does it
and check
depend on the
it.
place of the fibroid?
Yes, it's a study, meaning we don't have discrete say this is a, but the
Yeah,
clinical,
complex.
yeah. So if you attend the rotations, you understand. Okay, doctor is saying, "Arey, ye posterior fibroid, that this can get to infertility." It's more. So these are clinical judgments which can vary.
Yeah.
It can be contested. What I'm, but it's a discussion, so we can always talk about it.
So let's say after pregnancy is not in the picture, maybe pregnancy is not in the picture, but fibroids can be painful to
Yes,
many, and removal is also a stressful situation. Should we remove it, not remove it at
correct.
times, and they reoccur in body.
Yeah, yeah, that's it. That's how we'll come to it now. That what caused the fibroids. So general take is the disbalance of the hormones. So we have to check upon it. What is the issue? Is it hypothyroid? Is it the insulin resistance? What are the underlying other adjacent things which are happening in the body? Always you have to look at the totality. You can't look at the fibroid, take it out and done. No, it will again reoccur. That's what you said. Like,
Yes,
right? So,
yes,
yeah.
yes.
So we have to work upon the basis, the soil. Why did it develop at the first place? Did you find some abnormal, say, changes which you have not addressed too? So work upon that. Work upon the lifestyle errors. Reduce the obesity in case you're obese. Yeah. In case you're stressed, again, ease out your life. If you are, not having good night's sleep, then again you're in for trouble.
Yeah.
So few things added together can lead to a problem.
Okay. And how about reoccurring them? Say, let's
Yes.
say once you have a removal. So
Yes.
women in 40s and 50s, they experience reoccurrence of
Yes.
fibroids. So
Correct.
how
Correct.
do you address
So
that?
conservatively, if you ask me, in allopathy practice, they do give medicines to stop the growth, to
Does it
not
really
happen.
work?
Exactly, that's what I'm coming to.
Okay.
Yeah, I'm coming to. At the period of point, even we tell us, wait, hold on for a while. Let's see how it proceeds. If it is causing too much of a trouble, then we can think. But hold on for a while. Meanwhile, we can work upon the imbalance of the hormones, and we can give good homeopathic medicines here, because we are, again, as I said, we are going by the nature of the person, the setup of the hormones. According to the setup of the hormones, there are individual treatment or individual, portraits which are there. Okay, this constitution may require this because they are vulnerable to this. So there are innumerable constitution, and that is where the art lies in homeopathy, to find out which medicine will work good for this lady. Yeah, it's not as generic in allopathy. सबके लिए एक दवाई नहीं चलती है. And if you think logically, how will it work? It is a room and 4 people are sitting. Why only 2 suffer and 2 don't suffer? Right? So that is, we are talking about individuality. So similarly, you are different, I am different. My makeup is different, my hormonal setup is different.
True.
Till I don't work upon it and give medicines accordingly, it will not work. Just the regular, they do ye sab, the synthetic hormones that are being prescribed, and they don't even have good results that people realize. But it's okay. We have surgery, we have laparoscopies, we have,
Yeah.
see, we have to talk as the management of the patient. We are not here to understand the goodness of homeopathy and how bad allopathy is. No, sorry, I'm
When do
not
you
into it.
recommend laparoscopy?
See, basically, whenever the infertility cases come up and we are not able to understand what's the problem, then it's it's a very small invasive procedure to understand, to see what's going wrong. So you can visualize the tubes, you can see everywhere outside the uterus also, you can see if there are adhesions outside in the pelvic cavity. So it's a very good thing. Laparoscopy is it's a gem, meaning, without opening the abdomen, you are actually peeping in what's happening. So it's a good thing.
Yeah.
It's a very good investigation tool, and everybody should, when if needed, should go through it, rather than just depending on clinical practice. At times we are stuck. No. We need to see what's happening inside.
True.
So see the imaging, see the sonography, do the transvaginal scope to check the condition of the ovaries, which
Yeah.
are way below, which the USG doesn't cover. So polyps, the cervical polyps, which are the lower down, the ovaries can be visualized best in the transvaginal scope. So infertility, it's a really nice. It's like you can say, a detective science. अरे क्या
Yeah.
हो रहा है? Where is it
So,
going?
what are the treatments that you have for infertility?
Infertility. See, as I said, we go by the constitution of the patient. So we go by the, if the person is obese, or the cervix is relaxed, it doesn't hold the semen that well, it flows out, there's certain constitution. So we again are getting to a general level. I'm not talking about the cervixal, I'm talking about the general muscles, the skeleton,
Yeah.
that is weaker. Then again, your genetic history. If your mother, father have had illnesses, you may be vulnerable to it. So we give medicines to minimize those genetic tendencies. Lifestyle habits, it's up to the patient how well they manage their stress
But
levels.
I think when you plan pregnancies and child, everyone becomes very careful about, the
Yes,
lifestyle, and
yes.
everything becomes little more disciplined than before.
No, but your initial wrongdoings. Say,
Yeah.
suppose you are into smoking, you are into, drinking.
Alcoholic,
It
yeah.
all has an effect upon the ovum. So how
Yeah.
does the quality of egg deteriorate? You know, so it's because of the pollution. It's because of, again, the type of vegetables you're eating. It has sprayed. Again, the same thing. The plasticware, it has got certain things which can mimic estrogen and produce such effects. Then again, smoking, drinking, it reduces the quality of the eggs. So you're in for trouble again. So if you decide now I'm going to, it's 30, I'm now 35 years of age, now today, now doctor, I want to conceive, chalo, let's go to the doctor. It doesn't happen.
Yeah.
The uterus is such a thing, it requires a good environment to hold the baby for complete 9 months, with a good frame of mind, so that the baby is healthy. Baby is born in a good mood. That's very important. Your mood will
Yeah.
determine his, mindset.
Correct.
That's true. That's true.
So let's say somebody is smoking or say alcoholic. So after how many months of detox, the uterus is now thinking that it is properly detox and then
Now,
ready
this is
for
really related. This again is getting into a very, practical way. I want to do this, but tell me,
because
after.
see now because of the work stress or like requirements of social life and like in certain way now women have to
See,
present themselves like
moderation is okay.
okay,
Anything,
modulation, yeah.
yeah, anything in excess, your body will not be able to take it. As
Yeah.
simple as that. Even if you have to have a good meal, as moderation. ठीक है, एक आध बार खा लिया, once or twice a month, thrice a month, if we are eating outside, it's okay. The body can adjust, you know. But if you do it more and more, the body
Yeah.
gets into one compensation.
Yeah.
Don't blame the body. It's trying to cope up, mind you. You're pushing too hard, putting a lot of pressure. That is the time it gives up. And then the series of things start. And then
Yeah.
you have resistant obesity. It's not working, doctor. I'm walking, nothing, no inch law, meaning what is it? So it takes time. Give your body also time to recuperate. What wrong you have done, it will take those many years to come back. So better not do it, because your fertility years, are say. So that's why everything in
That will
moderation.
overall impact your health, the egg
Yes.
quality of eggs and
Yes.
then
Yeah.
health of uterus.
Yes. So
Yeah.
we're talking about women. There are problems with males also when it comes to the infertility. So the
Okay.
motility of the sperms, the quality of the sperms. So
Yeah.
that also is equally important.
See, both men and women have like a different body, I understand, but also work culture is same for all.
Yeah.
Like, it is stressful, demanding,
Yeah.
and it needs certain attention. Like,
Correct.
that you can't always give that much attention to your body. And, in
Yes.
that case, if you have to give that much attention, you have to pause, you have to stop,
Stop.
you know,
Rethink, redo.
rethink. Yeah, that's
That's a
what.
normal correction. We do it on any plane of whatever you're facing problems. We try to
Yeah.
rectify.
Yeah.
Same as with the body.
Yeah.
Yeah.
When you are planning for childbirth or pregnancy, there is a break in your career. There is
Yeah.
a break in many things that you used to do before, but now you are not continuing that because of the body, how it looks now and how it is changing, from inside. So the stress of new change,
Yes.
is what is
Yeah.
going to happen.
Adapting to the
Adapting,
change.
yeah. So that also has a stress on a body, and like
Yes.
it goes for both men and women.
Men
So
and women.
how do you deal with that?
See, basically, we have to be, counseling is very important here. There are certain things which can be done by talking to the patient, especially to a couple. Once that thought is, they get into it, okay, this is the logic is this, then they can think over it for a while and they come up with solutions themselves, because we don't know the whole picture
Correct.
in their house,
Yeah.
with the working, their financial, their emotional backup. Meaning, it's very difficult unless you
Difficult.
sit and talk it out with them.
Yeah.
So the major important field in infertility when you are dealing is understanding the overall aspect of that couple. What is wrong? And then do corrective measures, Yeah, and that's why we have certain things that, as you said, the career takes a break. So there are things which are, this freezing of the egg, the oocyte that we are having, the freezing of the embryo, so
Hmm.
that you don't miss out upon parenthood. It's okay. So we
So now coming to freezing of eggs and embryo, that becomes a part of IUI and IVF, which are also again infertility treatments. So what you have to say about this as a
It's
homeopathy
okay. Yeah, it's okay.
doctor?
See here, as I said, प्लम्बिंग डिफेक्ट है तो तुम होलिस्टिक का क्या करोगे? वो तो पार्ट को तो तुमको वर्कआउट करना है ना.
Correct.
If there is a problem conceiving because of a fibroid, you
Yeah.
have to get it
Removal, yeah,
removed.
is
Yeah.
must.
So that's what I've been saying, that homeopathy for chronicity, for balancing of the hormones, to develop a fertile background so that even your treatments work. There's so many failed IVF cycles.
Yeah.
Why? Because there is no balancing of the hormones. You're doing it everything by stimulating the ovary, creating a good bed for the embryo to get. How much will you pump the body? Why not give them, medicines which will balance in a little conservative way? With a homeopathic approach is good. So when we get cases, IVF cycle fail ho gaya, doctor, I'm very depressed. Yeah, you just hold on for a while. Take a break. Something is not working out.
True.
Let's put you upon medicines just for the general enhancement of your immunity, for balancing your hormones. You never know. There are patients who have conceived so nicely and with simple assisted procedures like IUI.
Can you differentiate between IUI and IVF?
I
Yeah.
will just touch it superficially. But
Yes.
IUI is intrauterine insemination, where you introduce semen into a woman's vagina at the time of ovulation, so that we facilitate the embryo formation, and so that at the right time at the ovulation time it happens, and it can help you know. Place embryo at the right time and then at the right location. So that's an easier option.
Okay.
IVF is little difficult because we have to create an embryo outside of the body. So you take up an egg, you take up a sperm from the male patient, work upon it, take the best quality sperm, and then in a, say, a petri dish or something, what they do is they unite both, form the embryo, and then go and place it back into the uterine cavity, because some pathway block is there, so you have to embed it.
Okay.
Now, this IVF, everything is successful. Everything, the follicular, everything went good, sperm quality also, but still, the endometrium did not receive the embryo properly because the system was not ready to accept. The woman's
Okay.
body was not in a good balanced state of hormones to receive the embryo, so it went waste.
So actually, when you take these treatments, like they prepare you with medicines, with hormones, and a lot of examination happens, lot of medication is given during that time. So in a way, your body should be prepared, no, for embryo
That is the problem,
acceptance.
no, that you have to handle multi-fats. Imagine, we should thank God how God has created a superhuman machine. We are doing it one by one and still we are not able to succeed. That means it's so multifactorial. The synchronicity of fall and rise of hormones and to the back-to-back embryo, and then so production of a human body and how it functions, ये तो कुछ भी नहीं है. We are just dealing with the infertility, the chromosomal abnormality. So God is great. The way the human body baby is created is a marvel.
Yeah,
And that's what we are going into it, dhire dhire. We will succeed. We'll get to it, don't worry. The
very
medical sciences,
optimistic.
yes. So the goodness of allopathy and with the help of homeopathy to balance the hormones, rather than pumping medicine just to stimulate the ovary to produce good eggs, it's a problem. The other hormones are also getting triggered. Too much of
Yeah.
ovarian stimulation is also not good.
Does that affect the acceptance of embryo in your body
No, we
and
are
resulting
trying.
in failed
Eh,
pregnancy?
It's okay. Depends upon the doctor's expertise, also how judgment
Yeah,
relevant. It's also,
also
that's very important.
it
So
works.
anyway, we see so much of desperation where couples are getting nahi ho raha hai. I said just leave it for a while. Just take a break. Don't shift your IVF centers. It's not going to work. There's something. The problem is somewhere else where they're not able to handle it. Just hold on for a while.
Yeah.
Yes. So It depends. So each case is different. Sometimes we
True.
find such good solutions. Nothing. Normally, also people conceive. There's a lady who was so obese. She tried so many IVF cycle. Nothing. I just told her to, you know, lose weight. Just
Okay.
concentrate upon your lifestyle. Concentrate. Be happy. In 6-8 months, she lost weight. The good part is that the ovulation, which was not happening normally, the
Okay.
the normal ovulation started to happen. Otherwise, all cycles were going anovulatory. Absolutely.
Hmm.
Then they tried everything. Hmm? Ova removal, which was not a very good quality. So the problem, we try and give solutions. It may not work. As I said, it depends upon the individual expertise. Hmm? So take the patient. The only advice to the patient is take the best of both the parties.
Hmm.
I don't know about
Got it.
Ayurveda, so I'm not in a position to speak. Must be good solutions there also.
Yeah.
So too much of intervention also sometimes spoils the case. Do it when it is needed.
Yeah.
Hmm?
So, but actually, IUI and IVF happens, do it when it's needed, that kind of,
Yeah,
where it's
but
the
nowadays
last.
everything has become so. You'll find so many IVF centers mushrooming, so
Yeah.
much. So that quality of service which patients are receiving is also deteriorating.
Also, the time you get married is like, earlier it used to be like, child marriage, then it is moved to 18-year-old, and now it is like, 28 is considered is very young to get married. So the age of marriage also changed, like, your profession is there. So obviously, like, child, planning for a family, planning for child and pregnancy comes very
Is
late,
delayed, is
delayed, that's
delayed.
very normal.
Right.
But you also mentioned about egg freezing. So can you tell us when is the right time to freeze the?
So the woman is born, a girl child, a baby is born with a fixed number of eggs depending upon the genetic inheritance or type. So when the baby is born, if you check, if you're talking about the numbers, the eggs are in millions. But
Hmm.
as the puberty comes in, the puberty sets in, the number comes to lakhs. And during the childbearing phase, when you get married and you decide to have, it is actually in thousands. So this is how the quantity of the quality as well as the numbers are reducing. So it's also the why, if you ask me why the eggs are, the numbers are going down, it's because of pollution, one. Secondly, because of the use of, say, pesticides, because of the soil you spray upon and those vegetables we are eating. So that is how the thing gets aggravated. The egg reserve goes down. And habits. We come to the habits, the smoking and drinking. So this is one of the leading causes for, and of course, stress.
True.
Stress meaning high cortisol levels, and oxidative stress goes high, and so the eggs are going down in numbers. It's okay. So, but what happens is that during each cycle also you are losing good amount of eggs. So there are two ovaries. So simultaneously in each ovary, say 10 eggs will start to mature, follicle will mature. Each one has an egg into it, but all don't mature into a good quality egg. Only one dominant follicle, as we spoke, will
Hmm.
get to a good, and the egg will be released. So you are losing each cycle also you are losing. So it's very important that you plan your pregnancy earlier the better. Yeah.
Okay.
But because of, as we said, we have career, we have so much more to do in life. So it's okay, but you should have your first child, say you should conceive at least before the age of 34, 35. You have got very, eventless pregnancies. You don't have complications. Hmm?
Hmm.
The child is healthy.
Yeah.
So I think that's quite okay. 35, before 35 is fine. But women, when they delay it, it's a problem.
The next chapter comes in our life is a menopause.
Yeah.
So how do you address menopause? Because that is also very challenging and crucial. You have different challenges during that time.
Yes,
So what do
correct.
you have to say about
So
it?
menopause, we get a lot of patients asking for medicines for hot flashes. Hot flashes are there, but it's not something very grave a problem. It can be managed. It's basically because of the imbalance of the hormones and connected with the thermoregulation mechanism in your brain. There is a disturbance, and so you're getting the hot flashes. The theme is to just go through it peacefully. Things will subside with little bit of help. So you don't have to go become very restless about it. It's just a passing phase. Something very important to talk about is the osteoporosis that happens during this phase. So
Can you
because
explain that?
yeah, so because of the declining level of the estrogen, the bones are getting, the skeletal is getting weaker and weaker. So it's very important to have strength training, during not during, but even before, if your lifestyle is good. So if you maintain good quality bones, muscles, and your the cartilages, everything is in good shape. Then actually, when the menopause strikes, when there is no good hormone support, the body will not deteriorate that faster. So it's very important to have a healthy lifestyle during, before, after menopause. That goes without saying.
So, like, when we are talking about our health in general, there are a group of doctors or expert, and like, they recommend strength training, but they also strongly recommend yoga,
Yes,
for
yes,
your health.
definitely. Yoga is something I always say comes first in the priority. Why? Because it is not only helping ventilate you, it is also giving good amount of oxygen to all parts of the body so that the inflammation goes down. The muscles, meaning, it's very important. Good oxygenation, good diet, good sleep. Hmm? These are the basics. We keep talking about it, but implementation is where the problem comes because of the practical problems. That because
The
so
other
you're,
implementation issue is the diet.
yes. So you have so much of things going around. As we said,
Yeah.
Swiggy. At the tip of a say button, you can call for things. If
Yeah.
that easy availability was not there, go to the kitchen, prepare nice. It's not feasible. You can't prepare such nice fat filled cheese and pura. It takes, so it was an impediment earlier.
Yeah. Tongue tempting
Yes,
food.
so now it's become so quick, and that is adding to the trouble. The aerated drinks, the high fat diet, high carb diet. So it's affecting the insulin sensitivity. So it's like you have a high sugar which is floating in the blood, and the insulin is also more to combat it. The muscles are not able to use the insulin because they are already loaded with
Yeah.
the already the glucogen is like the glucose which has been stored is full. The muscles are refusing to take any more store, and here we are taking more and more. So what happens? Finally, the brunt is on the pancreas to create more and more insulin, and finally that store is also depleted, and then say free sugar traveling in the blood, and you're diagnosed as diabetes part
PCOS
2.
and PCOD are
Yes,
also has lot about food, what kind of
yes,
food, the gut health, everything
yes,
starts, that management starts
yes,
getting into picture,
yes.
aggressively when you understand that you have a PCOD or PCOS.
Yes. So, if I talk about what is the link between PCOS and gut health, the gut health is very, very important. What happens is when you have a faulty diet, the permeability of the intestine, that is the wall, which allows the right type of nutrients or vitamins to get to the bloodstream, gets affected. Things that shouldn't go to the blood because of the abnormal permeability, because it is you're loaded your stomach with so much, there's fermentation, there is a wrong type of food, the permeability changes. Now this is something not written in the books, but sometimes you ponder what's going wrong, from where is the insulin resistance cropping, why. So definitely what you are eating is one thing that you have to work upon.
It's true.
Secondly, movement, the body movement is very important. So if the muscles, if you exercise, and also you are losing that, your body is utilizing the stored fat. Sometimes the liver is loaded with fat.
Yeah.
That's because of the same. It trickles down to the insulin resistance. The muscles are saying no, we are full. The liver is loaded with fat, but we have to change our lifestyle habits.
Next concern that every woman has is the infection,
Yes.
the UTI infection, or like, you have vaginal fungal infections, many sort of infection
Yeah.
they come across. How to
Yes. Manage that.
manage that?
See, we always talk about the flora of the gut. The similar flora is there in the tract of the urinary tract also,
Hmm.
kidneys, the ureters, the bladder. So when that flora gets disturbed, you are inviting infections. You are making yourself vulnerable to get more and more infections. Now, why does the flora gets disturbed?
Yeah, true.
You know, that's again same hormonal imbalances, your stress, and of course, hygiene that comes later.
Yeah.
But first, when the flora is disturbed, you get more and more infections. Plus, they are opportunistic infections, meaning it will remain dormant.
Okay.
The organism will remain sit dormant out there, and when it gets a conducive environment, say an imbalance of hormone or stress or exposure to unhygienic condition, it will flourish again.
Okay.
So this is how repeated UTIs, that's the resultant. And you keep taking antibiotics again and again, adding to the trouble. Once in a while it's okay, then you go that this antibiotic is not working.
Yeah.
You're resistant to it, then get to a higher antibiotic. But antibiotics itself are responsible for changing the flora. Hmm? You're solving the problem, but what about the recurrence? How do we do that? The private parts, there's too much of sweat, you're sitting all while for hours together, your profession doesn't allow you to move around, or you yourself are, you're sitting in the chair for long hours.
Yeah.
That's the time, the ventilation gets disturbed, the sweating. So all these conditions will invite the growth of organisms which are sitting dormant out there. So the theme is that you should wear, you know, clothing shouldn't be tight. You opt for a cotton clothing. Hmm?
More breathable.
More
and-
breathable, and move about. Even
Yeah.
if like we are sitting, we should make it a habit to just go here, there, not sit unless until you are driving you're in the cockpit and you can't move. But I
Yeah.
think they also have trouble because they develop conditions like piles. Why? Because they are so in enclosed spaces. We have so many patients who are flying, will coming up with fissures, with piles, because food habits, sitting in a constricting space, constipation because your bowels, meaning, and it's a stressful job. So
Yeah.
it's a complete thing that leads to a certain condition. So we'll come back to this. So always see to it that you wear good clothing, cotton clothing, you're moving about. And the most important thing I would like to tell, again, the stress levels lead to such repeated recurrence. The Savlon, the Dettol, yes, they are
Yeah.
helpful. And always remember not to scrub the area. When you scrub the areas, like you're doing, always just mop the areas.
Yeah.
Why? Because when you scrub, it's getting inflamed.
Suddenly after 10 years or 5 years you have bleeding happening, or you have some symptoms which you used to experience during, when you had menstruation and all that. So what is this a warning sign, and how women should
Yes.
address this?
See, once the menopause set in, meaning you don't have had periods for 12 months, meaning 1 year, there is absence of menses, you'll be like have reached menopause. Post that, if there is bleeding, it definitely needs to be investigated quickly as possible. Because sometimes the fibroids which are left, which we, left it thinking the menopause will come and, it will regress, they may again get activated, whether it is because the bleeding is because of the fibroids. But the alarming thing is that one should be always be aware about the endometrial lining, which post menopause becomes thin, meaning below 10 mm, 8 mm. It's so you have to see that the endometrium shouldn't get activated because of the change of hormones. If the endometrium becomes thicker, it is secreting. That means it has come under the influence of the changing hormones.
Okay.
Because of stress, because of genetic, meaning that is something we don't know why it should have had happened, but it happens, and that is the time it's alarming. You
Okay.
have to get to your gynecologist, take out the sonography, see what's happening, why the endometrium or the fibroid or the polyp is bleeding. That's a growth.
Yeah.
So it's very essential because endometrial cancers are very common post menopause. You've Menopause has reached after 10, 15 years because of, I don't know, anxiety, because of stress. That causative factors, we don't know which causes the bleeding. But at that time, we have to take active steps before it spreads.
I'm sure this holistic approach is going to help a lot of our audience. Thank you so
Sure.
much for coming to Imperia Connects.
Thank you, Madhvi. It's been a pleasure talking to you.
Thank you so much, doctor.
Thanks.
Thank you for tuning into today's episode. We hope this discussion has given you valuable insight into women's health and how to address common gynecological challenges. If you wish to connect with our guest today, please check out the details in description box. Remember, taking care of your health is the first step to feeling your best, and don't hesitate to seek help when you need it. Until next time, stay healthy and stay connected with Imperia Connects.